Well, good morning, good afternoon, good evening, everyone from all over the world. If you're interested in global health or if you're interested in soccer, this is the place for you today. We are very, very excited to start our World Cup plus Social Good Global Health Hangout this morning. We've got some really interesting guests. My name is Devi Thomas, and I'm the director of the Shot at Life campaign at the UN Foundation. Shot at Life is a campaign that helps bring Americans closer to the issue of global childhood vaccinations. And here with me today are two global experts in this very space from two of the leading organizations in global health today. And we're going to talk about something really interesting. We're going to talk about how two events are happening on the world stage at this very time. And these two events have a lot more in common than you might think. One of the events is the World Cup. Happens every 4 years, and as we know, it's one of the places where fanfare and corporations and NGOs get together to celebrate competition, to celebrate the coming together of countries from around the world, and that real national and international spirit every 4 years. The World Cup really represents that. But we're also going to talk about an important moment and milestone in global health. So if we talk about the World Cup as the beautiful game, as it is often described, I'm going to talk about the GAVI Alliance, the Global Alliance for Vaccines and Immunizations, as the life-saving game. And the combination of the beautiful game with the life-saving game is very creatively tied together by the One Campaign. So joining me today are the GAVI Alliance and the One Campaign. I'm going to start with the GAVI Alliance. We are very lucky to have in our presence Natasha Bilimoria, who is Director of U.S. Strategy at the GAVI Alliance. Natasha is a leading global health and development advocate and has more than a decade of leadership experience with the U.S. government and at respected non-governmental organizations. In 2013, we were very lucky because Ms. Bilimoria decided to join the GAVI Alliance as its Director of U.S. Strategy. She will be leading their efforts to mobilize U.S. support to fund global childhood immunizations in poor countries. Prior to this, she was president of the Friends of the Global Flight, where she led U.S. efforts to support life-saving work of the Global Fund to fight AIDS, TB, and malaria for 7 years. So we are very, very lucky to have Natasha in our presence. Also joining me this morning is Erin Hohlfelder, who is ONE's Policy Director for Global Health. She leads health policy analysis and manages relationships with technical partners across ONE's global markets, focusing primarily on infectious diseases, maternal and child health, and financing mechanisms. Before joining ONE, she worked as a policy associate for the Global Network for Neglected Tropical Diseases at the Sabin Vaccine Institute, where she helped to develop and lead advocacy, social media, partnership development, and legislative efforts around neglected tropical diseases. Thank you for joining me, Natasha and Erin. We are very, very excited to kick this off because I think the first question that's in everyone's mind is, what is the connection between the World Cup and GAVI, who's in the life-saving game of helping children around the world or helping children around the world receive access to life-saving vaccines. So Erin, I'm going to point it to you because ONE has done something so incredibly innovative in this space. So tell us a little bit about the Going for Goal report and how the World Cup ties into life-saving vaccines.
Sure. Thanks so much, Devi, first and foremost, for having us here today. It's great to have the opportunity with the World Cup just days away to chat with all of you and to talk more about the report that we've written. I actually have a copy here with me. As you can see, there's a green football field right in the background. But you're right, the link isn't perhaps the most intuitive, at least not just at face value, but we actually think the World Cup is the perfect time to start talking about GAVI and the important work of vaccines. So just like the World Cup, which is bringing together teams from 6 continents all over the world to play on a level compete on a level playing field, GAVI is also a story about the world coming together. It's different donors, different partners, different activists and technical partners, and even the private sector joining forces to help deliver vaccines. And just like the World Cup, which many of you will be following and tuning in starting on Thursday, you'll be hearing a lot about shots, saves, and goals. And so for us, those three terms have dual meaning, right? So when you think about shots, you don't just think about the shots made on the field, but you think about the shots in the arms of kids helping to save their lives. GAVI to date has helped support an incredible 440 million kids get those life-saving vaccines and shots that they need to stay healthy. Next, we'll talk about saves, so not just Tim Howard's big saves in the goal for the U.S., but also the millions of lives that have been saved through immunization. So just through GAVI's partnership alone with its many alliance partners, it's saved more than 6 million lives since 2000. And that's thanks not just in part to donor contributions, but also to the work of countries themselves who are delivering these vaccines on the ground. And finally, of course, we're talking about goals. So GAVI has already achieved many of its goals over the last a little bit more than a decade. It's immunized millions of kids, hundreds of millions of kids. It's saved millions of lives. But it has two big new goals that it needs to achieve over the next 5 years. It needs to raise an additional $7.5 billion from donors, and its goal is to immunize 300 million more children and save 5 to 6 million more lives. So as the World Cup kicks off, we wrote our report to essentially track how countries are doing in support of GAVI and in support of immunization, and what progress they need to make over the next 5 years to help GAVI achieve its next big goals.
Thank you so much, Erin. You know, and we know that 3.2 billion people watched live coverage of the 2010 World Cup, which was the last time that the World Cup happened. With less than $2.50 for each of those viewers, GAVI could help pay for all of its 2016 to 2020 financing needs in the amount that you mentioned. So this is really a perfect connection between these two world stage events. Natasha, we're really excited to have you here because could you tell us a little bit about the great work that GAVI does and why it's so important at this moment in time? Why is this an important year for GAVI?
Absolutely. Well, first of all, I also want to thank you, Devi, for being together with Erin, because I think we're the most health business, and so it's a real pleasure to be able to bring these two, very timely issues together. So I'm really happy to be here. So is that there's still 1 out of 5 kids around the world that don't get access to the vaccines, and that actually adds up to 22 million children a year. And in our mind, that's really an unacceptable number, and we need to do more to get to that at what we and replenishment is a word that I don't think a lot of people have in their vernacular. But what that means is this is an opportunity to work with our donors to raise money over a period of time. And it's important that we have money for more than a year, because what we do is we have to plan for it. And so what we're really entering into is a very important time where we're working with our donors to really explain why this $7.5 billion is so incredibly important for us to not only continue what we've been doing, but actually expand on this work. And Erin talked about what the results would be. I mean, if we were able to get the $7.5 billion, that means 300 million more kids would be immunized than have already been done by us. We would save an additional 5 to 6 million more lives, and that's actually nearly doubling the numbers from the year 2000. So we have the ability to really expand our work dramatically and get to more kids. But it's not only increasing the number of vaccines, but again, we want to make sure that we reach every child with basic and new vaccines. So again, it's not about we have to get more vaccine out, but most vulnerable and hardest to reach are actually able to receive these important health benefits. And not only will this work help prevent deaths and help kids live healthier lives moving forward, but it's also going to unlock you know, a significant amount of economic benefits, 80 to 100 billion dollars. And so what that really means is that not only can we make the benefits of vaccines in poor countries permanent for the next generation, but we also have the ability to move on that goal to eradicate extreme poverty by 2030. It's all very linked, and you know, and again, I think that we are in this critical stage where we said we would do something 5 years ago. We are doing it and are going to achieve it by the end of this year, and now we're moving on to the next phase. And it's really important that we continue building work to get to those kids that we still haven't reached.
Thank you, Natasha. You know, GAVI is a real game changer since we're talking about the game of soccer in this field in a big way. And Natasha in a little bit is going to tell us about how GAVI does that, a lot of the behind-the-scenes work that really make immunizations work. But it's not just that public health goal, but also the poverty goal that we're helping to achieve by supporting immunization work in developing countries. Now, I want to shift the gears a bit to soccer. And I want to mention the fact that the U.S. team just landed this morning in Brazil. They're gearing up for their practice for a week, I believe, and then their opening game next Monday with Ghana. So we're going to be talking about the U.S. and Ghana. And then, you know, I asked some colleagues who are a little bit more versed in soccer, who are we expecting to win this thing? I mean, what are the bets on? And we know that Germany's up there. We know that Spain's there, and people are betting on Brazil. So I'm going to turn it over to you, Erin, because I think that a lot of those countries have a lot to say with regards to soccer, but I think a lot of those countries have a lot of input and investment with regards to vaccines. And Erin, the report really highlights that. So can you take us through some of those countries mentioned in the report and what we need to know about them?
Sure. So as you mentioned, our report actually highlights the contributions of every single team that's playing in the World Cup. And for those of you who are following the tournament at home, we've actually broken it down by grouping. So on each two-page spread, we've got the teams playing in their groupings so that you can follow along. We're not so naive as to think that people are talking about vaccines and about GAVI every day, but certainly for the next month, people are going to be talking about the World Cup. So we really want to tap into that energy and excitement and enthusiasm and remind people that not only should they be proud of their teams playing on the field, but in many cases they should be proud of the work that those countries represented are contributing to GAVI and to immunization. So as an American, I'm biased. You know, I'm a little bit nervous about how we'll fare in the tournament this year. We're in what's called the group of death with some of the hardest other teams this year, so I'm a little worried. But I'm quite excited to watch. And our first game coming up is the United States against Ghana. So just as one example, I wanted to walk you through what our country profiles say about the United States and Ghana. So each of these profiles takes a look at financial contributions, political leadership, things like that, all the things that come together to make this effort a success. So when it comes to the U.S. has been a long-standing donor to GAVI. They've been around since the very beginning. And since GAVI's been around, they've contributed more than $1 billion. In fact, it's, I think, 1.2 billion is the latest figure. So that's no small chunk of change, and they've really been an ardent supporter, and have also complemented that work with bilateral other vaccine programs that have been supportive of GAVI's work. However, our report doesn't let them off the hook. The U.S. is known for being the biggest health donor, but in fact, the U.S. is only contributing roughly 35 cents per capita to GAVI. So that's way lower than some of the other big donors that GAVI currently has on the slate. And we think that the U.S. could and should step up its contributions to GAVI for the next 5 years to help make its replenishment a success and to really continue its leadership. So, you know, just as the U.S. soccer team is really starting to come into its own, we really hope that the U.S. government can step up its own efforts to GAVI over the next 5 years, both in terms of financing, but then also at home, making sure to focus on domestic outbreaks of vaccine-preventable diseases as well. We've seen a 20-year high in measles cases this year alone. So lots of work to be done by the U.S., even though they've been a strong and ardent supporter from the very beginning. Now, turning our attention to Ghana, many folks watching the tournament the last time around remember Ghana's big run through the tournament. They did so well and were really sort of the underdog that many people rooted for. And in the same way, I think Ghana is sort of this unsung hero of vaccination programs and what is really proof of what a country can do with GAVI support, but also with its own resources and its own commitment to this work. So Ghana, back in 2012, became the first country to roll out 2 new vaccines at the same time, vaccines to fight pneumonia and diarrhea, the 2 biggest killers of kids. And they did that exceedingly well. They had to revamp their whole immunization system, their cold chain, to make sure vaccines stayed cold at the right temperatures, and they did it really well. And that's not just because GAVI support, although that was quite critical, but it was also because Ghana has high-level political leadership in support of vaccines. President Mahama is a vocal supporter of GAVI and of vaccines and really helps provide political leadership to drive this agenda forward. Now, Ghana still has lots more work to do. It's not currently on track to hit the Millennium Development Goal for child survival, so certainly vaccines can play a big part in that. But we look forward to see Ghana continue to show leadership on and off the field. So that gives you a flavor of the type of analysis we're looking at country by country. And what we really hope you all will do who are watching is throughout the World Cup, as you watch some of these big marquee matchups, you'll reflect back on the report, they're really short and easy to digest. Take a look at what these countries are doing on immunization, and if you find something that's particularly interesting, tweet about it, share it on Facebook. We need all the buzz that we can get. So hope that's been an enticing offer, and we've convinced you to at least check out this report after we finish up.
So we're already seeing some questions come in on Twitter, but before I take that question that just came in for Erin on Twitter, I'm going to just kind of pause there for a second and switch to Natasha again. But I want to just mention something about pneumococcal and rotavirus vaccines that you mentioned that prevent pneumonia and diarrhea in developing countries. At the 2010 World Cup, more than 390,000 hot dogs were sold at a public catering concession stand. Now, that's roughly equal to the number of children that Ghana reached in its 2012 rollout of the GAVI vaccines, pneumococcal and rotavirus. So these connections keep continuing between the World Cup and GAVI. And then speaking of vaccines, Natasha, I want to send it to you for a second because $990 is the per ticket price for the best seats at the World Cup final. Now, that amount could purchase about 831 doses of pentavalent vaccine, which protects against 5 major killers of children. One of the many, many vaccines that GAVI is supporting. So tell us a little bit about how GAVI helps make vaccines affordable for countries, how GAVI accelerates the introduction of new vaccines, and also how GAVI is making sure that immunizations are sustainable at the country level.
Absolutely. Yes. So, I think the first important thing to remember is our goal is to get vaccines to people. And we do this in, what I think is actually a pretty innovative and unique way. And the first thing to remember is GAVI is an alliance. So we don't do this. We don't do it alone. We work very, very closely with partners. And rather than duplicating the work, we really take from all the key stakeholders in the vaccine space, and that includes donor countries, that includes UN agencies, that includes the private sector, and most importantly, it includes the countries themselves, and that's really where the process begins. It's the country that decides what vaccines they need, and it's their choice and their decision. And so that's really the beginning of the process. And what we do is we really work from that point into manufacturing, into supply chain, and we also work with our partners to do monitoring and evaluation, and then obviously making sure that the vaccine is in fact getting into that arm of each child. So let me go through each of those areas. So on manufacturing, you mentioned that the price of the pentavalent vaccine is a little over $1 per dose, and one of the things that GAVI does with its partners is something called market shaping. And what that means is because we buy vaccine at such a high volume. And pooled procurement really matters here. And so what we were able to do is work with vaccine manufacturers to really drive those prices down for the world's poorest countries. And we have been able to do that not only with the kinds of vaccines, but also helping to increase the number of vaccine manufacturers over time. When GAVI first started, there were about five companies that sold to poor countries, sold vaccines to poor countries. And now we're at 12. And many of those new companies are actually in new markets like India and Brazil and China, and so we are in fact really not only working to get those prices down, but actually really creating some competition between manufacturers, which helps with the price. So we do that work, with UNICEF, who is one of the key groups we work to procure the key group we work to procure vaccines with. We then obviously have supply chain issues, and what that means is really how do we get those vaccines into the country? And that's done in a myriad of ways, and again, through partners. And so we work with the private sector, civil society, as well as, again, get to the country level. And the other point that I want to make too with civil society is they play a really important role in the social mobilization efforts, because not only do we want to get vaccines to the people, but we want to get people to the vaccines. So it's important in these countries for people to know when vaccines are being introduced and why these are important vaccines for people to be giving their children. So civil society has also a very important role in ensuring that these things occur in country. Obviously with donor governments, and I should say that that's really the first step to ensure that we have the money to purchase these vaccines that countries are asking for. And we do that both in sort of your traditional ways where donors will provide funding to GAVI, but we also work with a number of innovative financing mechanisms that, again, really allow countries to do things that are a little more innovative and unique to try and get funding to the organization to get vaccines to the ground.
That's terrific. Thank you, Natasha. It's very interesting to hear about the innovative model and the GAVI model specifically, and also to hear about 5 to 6 million more lives that could be saved if we continue to support GAVI's efforts worldwide. So with that, I have a quick question that came in through Twitter I want to throw your way, Erin. And the question was really about how did you come up with the idea for your report?
Well, like all good ideas, it came to me in the shower. But in all seriousness, I mean, I think in part I've grown up as a tomboy and a huge sports fan my whole life, and so it's always been my dream to sort of marry my two passions for global health and for sport. So this report really does that and felt exciting. But I think more seriously, we are always looking for ways to sort of tap into the zeitgeist and what's in the news and what's popular to make our issues feel a little bit less dry and a little bit more exciting. I think sometimes GAVI, anything that starts with an acronym, feels a little bit wonky, right? So we know they're doing incredibly important work, but sometimes it's hard to communicate it in ways that feel user-friendly. So for us, linking it to the World Cup was a really fun way to talk about a really serious and important subject. And I think it also gave us a unique opportunity to showcase that it's about donors, but it's also really a partnership. As Natasha was saying, it's also equally as much about the countries receiving support from GAVI, talking about how they're using those resources, how they're dedicating their own resources and staff on the ground to making this work. And I think the World Cup and sort of the groupings where you see, big donors competing against small African nations on a level playing field really felt like the perfect opportunity to also tell the GAVI story.
That's fantastic, Erin. Thank you. And Erin, I'm going to stick with you for a second because I want to know what people can do who are tuning in and watching this live, but also people who watch this later on today. So the countries playing in the 2014 World Cup will contribute 62% of GAVI's resources for the 2011-2015 period. So this is a really important group of countries as well. But tell us what people can do around the world today to support GAVI's efforts.
That's a great question. Thanks for asking it. I would say first and foremost, we would encourage people to reach out to their leaders to encourage them to increase their support for GAVI. So there's lots of ways you can do that. You could go to one.org/vaccines and sign our petition to world leaders. You could call your member of Congress if you're here in the United States, or write a letter to your elected official anywhere around the world urging them. You could even tweet to your elected official and tell them that GAVI and vaccines are really important to you and explain why. So I would say that's first and foremost. They need to hear from their citizens and hear why this is so important in a time of, tight economic budgets. Secondly, you've been rattling off some of the fun stats that we've had in our report, and you've been a great PR agent for us, so thank you. And I would encourage people, on one.org vaccines, we have a lot of those fun stats about the hot dogs and about beer sales and about the ticket price and what that means for vaccines. We have all of those in great little tweets and share graphic form. So we would really encourage you throughout the World Cup to share some of these messages, to try and help us engage people who might not know a thing about vaccines, but who might really care about the World Cup. So help draw in new people. The last thing that we want to do is just preach to the choir here. We want to engage new audiences in support of this work. So tapping into those soccer and football fans all over the world, some of whom may be in your friends and family circles, we would love to engage them. So we would really appreciate your help in doing that.
That's terrific. Thank you, Erin. And definitely anything that's tweetable or share-worthy will be found on the One website because there's a lot of really great material there. I also encourage our U.S. listeners to go to shotatlife.org and to sign up for our pledge to support GAVI and the UN agencies and all the immunization efforts that are happening specifically through the website to make sure that your representatives here in the U.S. hear about this issue too. Certainly they are just as aware and just as interested in the global health issues as folks abroad. And as Erin mentioned, the U.S. government plays a critical role in GAVI and will hopefully do so in GAVI replenishment as well. So with that, Natasha, I just want to go to you with another question. When GAVI is in country and is working with local agencies to immunize children, can you give us a sense of the role that the ministries of health and the other ministries within country play, and how you are working with them to make this a sustainable initiative in country?
Sure. So I think one thing that's really important to understand for our audience that may be new to GAVI is that GAVI actually doesn't have any presence in the countries. The Secretariat itself is in Geneva, and that's really, again, where this alliance partnership comes in. And it's important to say, again, that it's really the countries who are taking leadership and ownership of these programs. They are the ones who know what their populations need and where the epidemics are, and they're really driving that process. And so what we try to do as the Alliance is really support them through that process. And so there are partners, many partners. I mean, between our bilateral donors, groups like USAID are providing technical assistance in countries to help really ensure that the investments that are made in GAVI are working. We have our UN partners, UNICEF, WHO, that are also working to ensure that, again, supply chains are working well, and that we are able to actually monitor what's going on to ensure that the work that we hope to do is actually getting done, and ensuring that the right policies are in place in country to allow for these things to occur. So our role is to purchase the vaccines, and I think this is also just leads me to another important point. We've been talking about donors, and obviously donors are a critical part, and the U.S. is obviously a very important donor to GAVI. But it's important for donors to also understand that these nations are doing a lot financially on this issue themselves as well. One of the very unique attribute is responsible for paying something for the vaccine they obtain. So even the poorest countries, pay 20 cents a dose for their vaccines, and that number goes up as countries' incomes go up. So there's a finance, and in this next period between 2016 and 2020, we actually expect that that number of co-financing will grow to $1.2 billion during that 5-year period. So that's a pretty sizable amount of money for that, given everything that's going on. And then also they are providing additional resources for their own systems. So this is very much a joint process, and countries, are very much taking ownership and working with partners to make this work. And GAVI is one of those critical partners in this process.
That's terrific. Thank you, Natasha. Very impressive work. Now, I also want to, for a moment, just in a very sort of sober tone, in 2012, an estimated 6.6 million children around the world died before reaching their 5th birthday. So this is an issue that also comes with, obviously, pulls at a lot of heartstrings, and there's a lot of people around the world that can get involved in this. One of the questions I have for you, Erin, is in doing the report, what are the countries that you found, maybe the top 2 countries that you found were doing exceedingly well and were probably performing above expectations? And then what are the 2 countries that you felt were really lagging behind and you'd really like to see step out?
Sure. Well, I think the first part of your question is an easy one. I think we see 3 donors at the top who are just sort of leaps and bounds above everyone else. So I would say that is the UK, which I must note is represented by England in the World Cup. But in our report, we look at all of the UK's contributions. That's an important point for our British colleagues. So the UK, has really done a phenomenal job, both in terms of money, but also in terms of political leadership, and we expect that that will continue. The second one is Norway. They've provided tremendous financial and political commitment really to the broader maternal and child health portfolio, and GAVI is a key piece of that. And thirdly, the Gates Foundation, has really been around from the very beginning, is a key technical partner, a key advocacy partner, and a key financing partner for GAVI. So those are the top 3 in my winner's circle. At the bottom, I don't want to call too many people out, but I would say there's sort of a next 9, right? There's a core group of 9 countries or so who are all really poised and should, I think, step up and do more. So that includes countries like the U.S., that includes countries like Germany, who just announced that they would host the replenishment meeting in early next year. They are, one of the strongest economies in Europe, and yet are contributing at a lower level than we might hope that they would. There's lots of other European countries who we think really can and should step up and do more. That's to say nothing of lots of donors who have given very little or nothing to GAVI. We think this really needs to be, we need to put the G in GAVI, right, the global alliance. So making this a truly global effort will involve getting lots of new donors to the table. That includes countries from the Middle East who may have oil wealth. That includes more private sector donors who will really stand to benefit from working in countries that have healthier populations. So there's plenty of room for lots of players to really step up their game. And just like in the World Cup, you never know when there's going to be an underdog that really steps up in a big and surprising way. So we hope to see a few underdogs step up for GAVI this year as well.
That's great, Erin, and a great way to call them out without calling them out.
If you read the report, we have more direct language in there.
Excellent, excellent. Natasha, there's another question on Twitter for you. Okay. And this question, you've answered in a little bit, but I think that more specifically I'm going to break it into 2. The first is, how do you through GAVI, get vaccines where they are needed the most? But also what I'm reading into that question is this nuances, how do you determine where the vaccines are needed the most, so where the need is the greatest? So sort of a two-part question there.
Yeah, no, that's a really good question. So again, how do we get the vaccines to countries? I mean, it's really about, again, it's about the countries themselves taking the lead. And I think countries do have a very strong sense of where they need to be putting their funding on vaccinations. And I think that in some countries we're seeing those coverage rates go up dramatically, and I think that we're working very closely with those countries. But then there are countries like Nigeria and India that are very big and also, population-wise, but also have real issues around immunization and vaccination. And so, this is where there's a partnership between, what GAVI is doing and, again, what our partners are doing to really work together to ensure that the country is getting the kinds of vaccinations they need, and to the extent that they need assistance financing them, doing that as well.
That's terrific. Thank you. And Natasha, sort of one more question along the same lines with regards to the introduction of new vaccines. Of the vaccines that GAVI has helped introduce, where have you seen the most return on investment? And I know that in general vaccines are incredibly cost effective and have a significant return on investment. But if you could give us an example.
That's a good question. I don't know that I have, a specific example of where we've seen that impact happen immediately. But, I have an interesting example of how GAVI really creates a catalytic effect in countries. So let's use India, actually, as an example. A few years ago, GAVI provided initial funding to introduce pentavalent and in certain districts. And what we found actually just this year, that the Parliament actually approved about $200 million, I believe the number was, to actually do this nationwide. So again, GAVI funding created the catalyst, and then the country really took over at that point. And so I think that that's really the kind of aid that we hope to do. And again, it's very catalytic. We will not be here forever. That's our goal. Again, as countries become wealthier, we want to, obviously make sure that their immunization rates are going up, but also help them be able to afford this on their own. And we actually do go through something called a graduation process with countries, where once they reach a certain income level, they have a period of time to really start taking on more and more and more of the cost of the vaccines, where after 5 years, they will actually be paying for their own vaccines completely through their own domestic budgets. So that's really the goal here. Yeah. And what we'll also see during this replenishment period is we expect that we'll have at least 20 countries that go through this graduation process over the next 5 years. So we're doing everything we can to ensure that that process is working well, and that we're able to help those countries sustain the gains that they've made while they have been GAVI eligible.
That's fantastic. And again, GAVI vaccines reaching over 70 of the poorest countries in the world. So a very, very, very important investment. So, you have the UN Foundation Shot at Life here, you have the One campaign here, and you have the GAVI Alliance here, all of us working together with the UN and other national and international players, really to make sure that immunization is a country-level priority politically and in global health, and is also an international priority. So a very important conversation that we hope is happening on the ground at the World Cup. Now, I don't know about you guys, my bet's on Brazil for this whole thing, but I wish all the luck in the world to all the teams out there, specifically the U.S. team. Any parting words, Natasha and Erin, for our teams who are out there dueling this out?
Well, what I'll say is, again, I really appreciate the interest in this. And again, this is a critical year, and we have a real opportunity together as a global community to ensure that more and more children's lives are being saved, and really working towards ending preventable child deaths and working toward eradicating extreme poverty. And I think we are really at an important point, and I hope we can be working more together on this.
Excellent. Thank you, Natasha. And Erin?
I mean, I think that's a pretty perfect closing message from Natasha. So I just thank you for having us and for all of your support and enthusiasm around our reports. It's not often that a policy report feels fun and exciting, but this may have cracked the nut. So we're thrilled for your support and for the partnership with Shot at Life and with GAVI and so many of our other partners in the community. So thanks again.
Thank you, everyone, for tuning in. Please go to the one.org website to download the Going for Goal report to read more about what we can do to support GAVI's efforts this year. Thanks, everyone.
Thank you.
Thanks. Bye-bye.
Bye-bye.
Bye.